Think your period is just about cramps and mood swings? Think again. From itchy skin to random tooth pain, your cycle can trigger strange side effects doctors rarely mention. Here are the weird, surprising period symptoms no one warns you about. Do any of these sound familiar? This sets curiosity, makes it relatable, and invites people to keep reading. Tooth and gum sensitivity. When we talk about periods, the usual suspects show up. Cramps that curl you over, bloating that makes jeans unbearable, or mood swings that make you want to cry at a commercial. But every month, countless women also notice something far less expected. Their teeth and gums suddenly hurt. It feels random at first. You brush your teeth like normal, and suddenly, there's blood in the sink. Or maybe your favorite iced latte sends a sharp, shocking sting through your teeth. Some even describe it as a dull, nagging ache that shows up right before or during their period and disappears just as suddenly when it's over. And here's the kicker. Most people have never been told this could be linked to their cycle. The science behind the smile. Your gums aren't just soft tissue. They're filled with tiny blood vessels that respond to hormonal shifts. When estrogen and progesterone rise and fall around your period, they cause increased blood flow and changes in how tissues hold fluid. That's why you might notice swollen fingers, puffy skin, and yes, inflamed gums. Dentists call this menstrual gingivitis. It's not full-blown gum disease, but it mimics it. Redness, swelling, tenderness, and bleeding. For some women, even flossing gently feels like a battle. On top of that, estrogen plays a role in collagen production and how your body responds to plaque bacteria. So during your period, your gums can actually be more reactive, as if your immune system is overreacting to even a tiny bit of buildup. That explains why your mouth might feel off, even if your dental hygiene hasn't changed at all. Real-life experiences. One woman described it like this. I thought I had a cavity because every time I drank something cold, my tooth felt like it was on fire. But my dentist checked and said everything looked fine. Then I realized it only happened the week of my period. Now I track it, and it's so consistent, it's almost like a second clock. Another said, every month my gums get sore, and I thought I was brushing wrong. It wasn't until I read about menstrual gingivitis that I realized it wasn't me. It was hormones. This cycle-to-mouth connection is rarely discussed in doctors' offices, which leaves many women confused, worried, or even scheduling unnecessary dental visits. Who feels it most? Women with existing gum sensitivity or early gingivitis often feel worse during their periods. Those on birth control pills, which keep hormones at steady but altered levels, may experience gum changes more strongly. Pregnancy and perimenopause can bring even more dramatic gum symptoms, further proof of how much female hormones influence oral health. What helps? Practical relief. While you can't shut off your hormones, you can reduce the discomfort. Here's how. Switch to a soft bristled toothbrush. Less irritation, more comfort. Stay hydrated. A dry mouth worsens irritation. Sip water regularly. Warm salt rinses. Gentle, natural way to calm inflamed gums. Cut back on sugar and acidic drinks. Less plaque buildup, calmer gums. Ice pack trick. If swelling feels uncomfortable, apply a cold compress to the outside of your cheek for 5 to 10 minutes. Track it. Write it down in your cycle tracker. If it always happens during your period, that's a clue it's hormonal, not dental decay. If the pain ever becomes severe or lasts beyond your cycle, then yes, see a dentist. But for most women, this symptom is temporary and tied directly to their period. The bigger conversation. Tooth and gum sensitivity may sound like a small inconvenience, but it speaks to a larger truth. Women's health is full of symptoms that aren't openly discussed. Generations have been taught to associate periods with just cramps and bleeding, when in reality, the menstrual cycle touches almost every system in the body, from your skin to your sleep, from your digestion to your teeth. Your hormones leave fingerprints everywhere. Tooth and gum pain is just one of those subtle reminders that your body is more interconnected than you realize. So if you notice your gums acting up every month, don't dismiss it or blame yourself for bad brushing. Instead, recognize it for what it is. Another weird, under-the-radar period symptom that deserves more awareness. The digestive roller coaster periods already come with their fair share of discomfort. But for many women, the most unpredictable and often most embarrassing symptom isn't cramps or mood swings. It's what happens in the gut. 1 week, you're battling constipation, feeling sluggish and bloated like you've swallowed a balloon. A few days later, as soon as your period arrives, it flips. Urgent bathroom trips, noisy stomach cramps, and digestion that feels completely out of control. If this sounds familiar, you're not alone. It's not bad luck or something you ate. It's your hormones, once again, pulling the strings. Why it happens. Hormones versus your gut. Your menstrual cycle is orchestrated by two main hormones, progesterone and estrogen. In the days before your period, progesterone peaks. One of its jobs is to relax smooth muscles. Great for preparing the uterus, not so great for digestion. Relaxed intestinal muscles equals slower bowel movements, constipation, heaviness, and bloating. Once your period starts, your body produces prostaglandins, chemicals that help the uterus contract and shed its lining. But prostaglandins don't play favorites. They can also make the smooth muscles in your intestines contract more intensely. Diarrhea, stomach cramps, and sudden urgency. It's basically like your uterus and your intestines got their wires crossed. The real-life struggles. This gut hormone link is so common that many women can predict their cycle by bathroom changes alone. Yet, because it's rarely discussed in doctors' offices, most feel like they're the only ones dealing with it. One woman explained it like this. I used to think I had food poisoning every month. Day 1 of my period, I'd be in the bathroom 5 times before lunch. Then I learned about prostaglandins and realized it wasn't random. It was my cycle. Another said, for me, it's the opposite. I don't go for 3 days before my period, and it feels awful. Then once bleeding starts, my body overcompensates. It's like clockwork now. These shifts aren't just inconvenient. They can be painful, exhausting, and sometimes socially embarrassing. Imagine being in an office meeting when your stomach suddenly growls like a thunderstorm, or rushing for the restroom in the middle of class. For many, it's one of the most stressful period symptoms. Other digestive side effects. Beyond constipation and diarrhea, hormones can trigger excess gas and bloating. Slower digestion plus water retention equals puffy belly. Louder stomach noises. Hormone-driven gut spasms can make digestion extra audible. Cravings that backfire. That chocolate bar or cheesy fries, comforting in the moment, but harder to digest and more likely to worsen bloating. Worsening of existing gut issues. Women with IBS, lactose intolerance, or gluten sensitivity often report stronger flare-ups during their cycle. What you can do. You can't outsmart your hormones completely, but you can ease the ride. Eat lighter, easier to digest meals. Soups, smoothies, steamed veggies, and rice are gentler on your gut than greasy or fried foods. Add fiber strategically. Pre-period constipation benefits from oats, bananas, chia seeds, or leafy greens. Once bleeding starts, stick to soluble fiber, like apples or carrots, to prevent worsening diarrhea. Stay hydrated. Water keeps digestion moving and reduces bloating. Herbal teas like peppermint or ginger also soothe cramps. Go easy on caffeine and alcohol. Coffee stimulates the gut. Hello? Urgency. While alcohol irritates it. Limiting both helps balance your system. Use heat therapy. A warm compress over your lower belly can relax both uterine and intestinal cramps. Track your cycle. Knowing when digestive shifts are coming helps you plan meals, hydration, and bathroom access in advance. Attack when it's more than just period trouble. While digestive chaos is common during periods, severe or long-lasting symptoms could point to something more. Conditions like endometriosis, PCOS, or irritable bowel syndrome, IBS, often overlap with cycle-related digestive issues. If your gut symptoms are extreme, last beyond your period, or interfere with daily life, it's worth consulting a doctor. The bigger picture. The gut isn't just near the uterus. It's part of the same network of muscles, nerves, and hormones. That's why your period never affects just one part of your body. Your reproductive system is deeply tied to your digestion, your immune system, even your brain chemistry. Digestive changes are a reminder that periods are whole body events, not just bleeding days. When your cycle shifts, your entire system reacts, even in places you'd never expect. Achy joints and back pain. When people think of period pain, the first thing that comes to mind is uterine cramps. But for many women, the pain doesn't stay neatly in the pelvis. Instead, it radiates out, creeping into the lower back, hips, or even knees. Some describe it as a dull stiffness, others as a heavy ache that makes every step feel harder. It can be confusing, even alarming. Why do my joints hurt when I'm on my period? I thought this was just about cramps. The truth is, your period isn't an isolated event happening in your uterus. It's a hormonal storm that affects your entire body, including bones, joints, and connective tissues. The science of why it happens. Here's what's going on under the surface. R1. Estrogen withdrawal. Estrogen doesn't just regulate reproduction, it also plays a major role in joint health. It helps protect cartilage, maintain bone density, and reduce inflammation. Right before your period, estrogen levels dip sharply. Without its protective effect, joints can feel stiffer and more sensitive to pain. This is why some women notice their knees ache or their lower back feels creaky right before bleeding starts. Prostaglandins equals double trouble. Remember prostaglandins? Those hormone-like chemicals that trigger uterine contractions, aka cramps? Well, they don't just stay in the uterus. High levels can leak into the bloodstream, triggering inflammation and muscle contractions in other parts of the body. This can leave joints swollen and tender, and muscles in the lower back feeling sore. 3. Fluid retention. Hormonal shifts also cause water retention. That's why you feel puffy or bloated before your period. But this extra fluid doesn't just sit in your belly. It can settle in your joints too, leading to stiffness and swelling in places like the knees, ankles, or even hands. 4. Ligament loosening. In some cycles, higher levels of relaxin, a hormone more commonly linked with pregnancy, may make ligaments more flexible. While that might sound like a good thing, looser ligaments can actually make joints feel unstable, sore, or prone to small twinges. What it feels like, real-life stories. For some women, it's subtle, a nagging ache in the lower back that feels like sitting too long at a desk. For others, it's sharp hip pain that makes walking uncomfortable, or knee stiffness that feels like early arthritis. One woman shared, "I used to think I had back problems. Every month, like clockwork, I'd get this horrible ache that made it hard to sleep. But once my period ended, it disappeared. I finally realized it wasn't my spine, it was my cycle." Another described her joint pain as, "Like I've aged 40 years for a few days. Stairs feel impossible, and my knees just throb until my period is done." Where it shows up. Most lower back, often linked to uterine contractions radiating outward through shared nerve pathways. Hips and pelvis, connected by ligaments that shift with hormone changes. Knees and ankles, affected by estrogen's role in joint lubrication and collagen support. Hands and wrists, fluid retention can cause temporary stiffness or swelling. What you can do, relief strategies. While you can't stop hormone shifts, you can make them easier on your joints. Heat therapy. A heating pad on your lower back or hips can ease stiffness and relax muscles. Gentle stretching yoga. Poses like child's pose, cat-cow, or hip openers help release tension. Stay active. Low-impact movement, like walking, swimming, or cycling, boosts circulation and reduces stiffness. Anti-inflammatory foods. Think salmon, flax seeds, turmeric, ginger, and leafy greens to naturally calm inflammation. Magnesium and omega-3s, both shown to reduce menstrual pain and support joint health. Pain relief. Ibuprofen or naproxen work double duty, easing cramps and lowering inflammation in joints. Massage and foam rolling. Gentle self-massage or rolling can release muscle tightness around sore joints. When to seek help. If your joint or back pain is severe, lasts beyond your cycle, or worsens each month, it could signal something more, like endometriosis, arthritis, or another inflammatory condition. In those cases, it's worth consulting a doctor. The bigger picture. We're often taught to think of periods as an isolated uterine event, but the reality is that your hormones ripple through your entire body. When estrogen drops and prostaglandins rise, your joints, ligaments, and muscles feel it too. So if your lower back aches or your knees throb during your cycle, you're not imagining things. It's not just getting older or sleeping wrong. It's another one of those under-the-radar period symptoms that deserve more awareness. Bottom line, period pain doesn't always stay in the pelvis. Sometimes it travels through your whole frame, reminding you that hormones touch every part of your body. Strange skin flares. Most people expect a pimple or two around their period, But for some women, it's more than just acne. Your cycle can trigger unexpected skin changes, from itchy patches of eczema to random hives or rashes that seem to come out of nowhere. These flare-ups often leave women confused, reaching for allergy creams or blaming new products, never realizing that the real culprit is hormonal. Why it happens. Hormones meet your skin. Your skin is one of the most hormone-sensitive organs in your body. It reacts to every rise and fall of estrogen and progesterone. And here's how that shows up. Estrogen's role. When estrogen is higher, mid-cycle, skin often looks brighter, plumper, and more hydrated thanks to boosted collagen and blood flow. Progesterone spike. In the luteal phase, the week before your period, progesterone increases oil production. For some, this means breakouts. For others, it clogs pores and makes skin feel itchy or irritated. Estrogen drop. As estrogen plummets right before your period, your skin loses some of its protective barrier strength. This can leave it drier, more sensitive, and prone to inflammation. Combine all this with immune system changes that happen during your period, and the result can be random flare-ups, even ones that mimic allergies. What it feels and looks like. Eczema or dermatitis flares. Dry, itchy patches, often on hands, arms, or face. Hives or red splotches. Raised, itchy bumps that come and go quickly. Breakouts beyond acne. Some women get small rash-like bumps instead of deep pimples. Extra sensitive skin. Products that normally feel fine suddenly sting or burn. One woman shared, every single month throughout, the skin on my neck turns blotchy and itchy a day before my period. I thought I was allergic to my laundry detergent until I realized it lined up perfectly with my cycle. Another explained, it's not just acne for me. I get these tiny rash-like bumps on my arms and chest that vanish once my period ends. It's so weird. What makes it worse? Stress. Cortisol spikes before your period can amplify inflammation in the skin. Diet. High sugar or dairy intake during cravings can worsen breakouts and hives. Existing skin conditions. Eczema, psoriasis, or rosacea often flare up around hormonal shifts. What can help simplify skincare? Stick to gentle, fragrance-free products the week before your period. Hydrate skin deeply. Use a richer moisturizer when estrogen dips to help prevent dryness and irritation. Cool compresses. Calm itchy inflamed areas with a clean, cool washcloth. Anti-inflammatory diet. Omega-3s, salmon, walnuts, chia, and antioxidants, berries, greens, help reduce flare-ups. Manage stress. Breathwork, yoga, or even short walks help lower cortisol-driven skin stress. Spot treatment. For hives or severe itchiness, OTC antihistamines or hydrocortisone cream may help if needed. When it's more than a flare. If skin rashes are severe, spreading, or come with swelling in the lips, eyes, or throat, that's a medical issue, not just hormones. But for most, these flare-ups are cyclical, harmless, and annoying more than anything. The bigger picture, skin isn't just about vanity. It's a mirror for what's happening inside. Period-related skin flares are your body's way of saying, hey, hormones are shifting again. And while they can feel random, once you start tracking them, you'll often notice a pattern. Recognizing that pattern makes it easier to prepare, swapping skincare products, changing diet, or adjusting stress management at the right time. Bottom line, periods don't just affect how you feel inside. They show up on your skin, sometimes in ways that look nothing like normal acne. Strange food and smell sensitivity. Cravings are practically a running joke when it comes to periods. Chocolate, chips, ice cream, you name it. But what about when your period makes you suddenly hate the smell of your favorite coffee, or gag at the scent of someone's perfume, or feel nauseous at foods you normally enjoy? It's not just cravings. For many women, periods bring a whole new layer of weird food aversions and hypersensitive senses. Why it happens. Hormones and your senses. Your brain and senses are tightly linked to your hormones, especially estrogen. Estrogen influences neurotransmitters like serotonin and dopamine, which control appetite, mood, and even sensory processing. Here's what happens. Heightened sense of smell. During the luteal phase, the week before your period, many women become extra sensitive to odors. This is thought to be an evolutionary holdover. Heightened smell once helped women detect unsafe food or environments when fertility was highest. Taste bud changes. Hormonal fluctuations can alter how sweet, salty, or bitter foods taste. That's why chocolate may taste irresistible one cycle, but too sweet the next. Nausea and aversions. Progesterone can slow digestion, and combined with scent sensitivity, certain smells or flavors can feel overwhelming, even nauseating. The real-life experience. One woman explained, "Right before my period, I can smell everything like my boyfriend's cologne from across the room. Sometimes it's nice, but other times it makes me feel sick. Coffee, which I normally love, suddenly smells burnt and gross." Another shared, "The week of my period, I crave salty chips like my life depends on it. But weirdly, I can't stand chicken. I gag just cooking it. Then once my period ends, I'm back to normal." Common food and smell quirks during periods. Suddenly craving carbs, sweets, or salty snacks. Feeling nauseated by meats or strong-smelling foods like eggs, fish, or garlic. Finding perfume, cleaning products, or even body odor unbearable. Loving chocolate one week, hating it the next. Weird cravings for things you don't normally eat, pickles, sour candy, or spicy food. Hashtag, what can help honor your body? If a smell or food feels overwhelming, skip it. Forcing it often worsens nausea. Smart substitutes. If you crave sweets, try fruit or dark chocolate. For salty cravings, roasted nuts or popcorn can be lighter alternatives. Smell hacks. Essential oils like peppermint or citrus can mask odors and calm nausea. Balance blood sugar. Eating proteins, complex carbs together, like hummus with whole grain crackers, can reduce wild cravings and sudden aversions. Stay hydrated. Sometimes weird cravings are your body's way of asking for fluids. When it's more than a quirk. If food aversions and nausea are extreme, or if you feel sick every cycle, it could point to conditions like PMDD, premenstrual dysphoric disorder, or even endometriosis, since both can intensify gut hormone sensitivity. The bigger picture. We tend to laugh off cravings as a funny period stereotype, but they reveal something deeper. Your hormones are literally rewiring how your senses perceive the world. Smells feel sharper. Tastes shift. Foods feel different in your mouth. It's your body's way of signaling what it wants and warning you away from what it doesn't. Once you start noticing the patterns, these quirks become less random and more like part of your monthly rhythm. Bottom line, your period doesn't just change what you crave, it can change how the whole world tastes and smells. Period headaches and migraines. When people think of period pain, they usually imagine cramps in the lower belly. But for many women, the worst pain isn't even in the uterus, it's in the head. Every cycle, like clockwork, the ache creeps in. A throbbing temple, pressure behind the eyes, a stabbing pain that grows worse with every movement. For some, it builds into a full-blown migraine that can last for hours or even days. These aren't just ordinary headaches. They're menstrual migraines, and they're one of the most under-discussed period symptoms. Why your period can trigger headaches. The root cause lies in hormones, specifically estrogen. Throughout the menstrual cycle, estrogen rises and falls in carefully timed waves. During the first half of the cycle, estrogen climbs, boosting serotonin, the feel-good chemical, and stabilizing mood and energy. But right before your period starts, estrogen levels crash suddenly. This withdrawal acts as a switch that flips the brain into migraine mode. Here's why that matters. Estrogen directly affects neurotransmitters in the brain, like serotonin, that control how sensitive we are to pain. When estrogen drops, blood vessels in the brain constrict and then dilate, which is thought to trigger the throbbing pain of migraines. Progesterone, which also falls before menstruation, adds fuel to the fire by increasing inflammation. In other words, your brain literally feels your period, the experience. What period migraines feel like? Unlike a regular tension headache, period migraines often come with a brutal list of side effects. Throbbing, pulsing pain, often one-sided. Sensitivity to light, sound, and smells. Even a phone screen or faint perfume can feel unbearable. Nausea and vomiting that make eating impossible. Visual disturbances, aura, flashing lights, zigzag lines, or blind spots. Fatigue and brain fog so heavy it feels impossible to think straight. Some women know the migraine is coming before it even arrives. A strange prodrome phase can bring food cravings, mood swings, yawning, or difficulty concentrating, like a storm warning flashing in the brain. Stories women don't tell enough. One woman described it like this. People always assume I'm curled up with cramps during my period. They don't know it's actually the migraine that keeps me in bed. My head pounds so hard that I can't even walk to the bathroom without feeling dizzy. Another said, every cycle, like clockwork. The day before my period, I get the aura, flashing zigzags in my vision. Then the pain comes, and I know I've lost the next 24 hours. These stories remind us, period migraines aren't just headaches, they're disabling. What can make migraines worse? Hormones may be the trigger, but everyday factors can amplify the pain. Stress. Emotional tension raises cortisol, which makes migraines harder to manage. Sleep disruption. PMS often messes with sleep quality, leaving the brain more vulnerable. Caffeine highs and crashes. Too much or too little caffeine can both trigger pain. Dehydration. Even mild dehydration makes blood vessels more sensitive. Food triggers. Chocolate, cheese, red wine, artificial sweeteners, and processed meats are common culprits. For women prone to migraines, these triggers stack on top of hormonal shifts, creating the perfect storm. How to cope and prevent them. The good news? While you can't always stop hormonal drops, you can soften the blow. Lifestyle support. Hydration first. Aim for steady water intake throughout your cycle. Balanced meals. Pair protein with complex carbs to stabilize blood sugar. Magnesium magic. Foods like almonds, spinach, and pumpkin seeds or magnesium supplements may reduce migraine frequency. Gentle movement, yoga, stretching, or walking can improve blood flow and reduce stress. Have relief strategies. NSAIDs, ibuprofen, naproxen, best taken before the migraine fully develops. Caffeine, in moderation. A small dose can help, but overuse leads to rebound headaches. Cold compresses, ice packs on the forehead or neck can numb pain. Quiet, dark environment. Migraines thrive on overstimulation, so remove sensory triggers. Medical options. Triptans. Medications designed specifically for migraines. Hormonal treatments. Birth control or hormone therapy can sometimes even out estrogen dips. Cycle tracking. Predicting when migraines hit makes prevention possible. Some women take medication only in that window. When to seek help. If your headaches are debilitating and recurring every cycle, always one-sided, paired with vision loss or aura, or resistant to over-the-counter meds, it's time to see a doctor. Period migraines are real, valid, and treatable. The bigger picture. Migraines are a reminder that your period is more than cramps and mood swings. It's a full-body, whole-brain event. Hormones don't just shape your uterus. They shape how your nervous system perceives the world. For some, that means the monthly burden isn't just bloating or irritability. It's a dark room, a pounding head, and hours lost to pain. The more we talk about it, the less women will suffer in silence, chalking it up to just part of being a woman. Bottom line, period migraines aren't weakness. They're biology. And once you learn to recognize the hormonal pattern, you can finally stop feeling blindsided and start taking control. Your period isn't just about cramps. It's a full-body story your hormones tell every month. From your gums to your gut, from your skin to your head, every strange symptom is your body speaking. The more you listen, the more power you have to care for yourself beyond the cliches. Want me to also give you a few shorter, punchy variations of the ending line? Good for real?